what we are going to be covering today is ergonomics in dentistry. And this is a personal thing for me because when I started dental school, I wanted to be an oral surgeon and did all the stuff, went to oral surgery study club, all that sort of thing. And after the first year, I was having to ice my wrists because I was in so much pain. I was doing yoga literally every single day because my shoulders and neck and back and everything were just so messed up from dentistry. And I realized really quickly that oral surgery, you stand the entire time, you're bent over, you're always in kind of like a negative position for ergonomics and for longevity. You don't see a lot of oral surgeons in their 60s still practicing. Just kind of think through that. And because of that, I looked to do something else. And so I actually had a root canal on number 7 and had a good experience having that done, even though it took 3 appointments and had to leave it open and all sorts of fun things. And started hanging out with the endodontists and realized that they were big nerds like me and all of you. And that's how I ended up in endo. So this is if I had actually learned how to do everything properly, maybe I would have been an oral surgery bro, but I don't think that's actually the case. I'm happy I did endo. So, as far as how this works, let me click over here. Good, okay, cool. One day, you're going to do your last root canal. That's just inevitable. That's how life goes. I know that's kind of a weird thing to say to the first years on the very first lecture when you're just trying to learn how to do as many as possible, but that's just math. One day, you will do your last root canal. The question I have for you is, do you want to choose that day, or do you want to have that day chosen for you? And so when we look at the literature for early retirement of dentists, this is from the British Dental Journal back in 2010, the average age at retirement was 51 and a half. And seeing as the average normal age of retirement is in your 60s, that's a lot earlier than a lot of people may have planned for or want to retire for, which is why disability insurance is important. But prevention is even more important. Of those reasons for early retirement, musculoskeletal disorders were 55% of them. And I don't know about you all, but more than half of the faculty at UOP's dental school were there because they couldn't practice full-time anymore. Dr. Hatton is there because he can't practice full-time anymore. It's really, really common for these, for musculoskeletal disorders to cause you to need to retire early. Mental and behavioral disorders were 28% of that, and we will for sure talk about that in future lectures because these are all 3 things that are very important to me. 90% of those who had to retire early said that their health issues that caused them to no longer be able to practice were work-related. So this is a big deal. What we do, it doesn't seem like it's that hard because it's like you're just doing this all day long. You're just moving files. But that repetitive motion, in a way, we are sort of like athletes. We're not athletes in that we can sprint fast and have big muscles. I wish Greg was still here because he was our big muscly dude. But what we do, that repetitive motion all day long, you kind of have to train for it like you would if you were an athlete, and you have to get into the mental state like you're going into a game because what we do is hard, but we can make it a lot easier. Quick aside, if you're ever in a dark place and need help, we're there for you. You all have my phone number. This QR code is for the ADA's mental health resources. It's fantastic. The current president is really big on this. And if you ever have like suicidal thoughts or anything in the United States, you can always call or text 988. It's like 911, just one below. I've lost classmates and colleagues to this. So if you're ever in a dark spot, I'm always there for you. You all have my cell phone number. I'm here for you. So let's go change the mood a little bit and talk about the importance of learning good habits now. So Carmen, you asked what my thing would be. Learn your good habits now. That will be that's kind of like the thesis of this lecture is learn how to do it right now. Don't learn those bad habits. There's an old saying, and for those second years, I'm definitely the Lorax and I love my trees. The best time to plant a tree was 20 years ago. The second best time is now. So the reason I say that is I don't know many endodontists who can't find MB2, who can't get patent after you're 10 years out. I do know a lot of endodontists who have no idea how to sit properly. And so this was posted recently on Instagram. I'm not going to say which channel, but you can see him saying, saving another tooth. It's great. Now, what do we see here? We see the neck in a terrible position. A fusion surgery is going to be about $60,000 to $150,000. You're going to be out for a month and a half with about a year and a half of PT. and you're going to lose anywhere from about $60,000 to $100,000 in wages. Shoulders, you can see those are up. Those are peacocked up like this, chicken winged. $50,000 to $30,000 for that surgery, out about a month and a half with a year of PT, about $100,000 lost wages. This is not to include the issues that you can have with back surgery, wrist surgery. And the thing that also kind of makes me laugh here, that's a $15,000 microscope, and I know that chair. I hate that chair, but it does have armrests. Notice the microscope is floating off in the distance, not being able to help him at all, which would fix a lot of the issues he's having with his neck. And that chair, he's got great supports that are right there. And instead, we're chicken winging it out, causing extreme wear on these muscles and joints right here. So this was posted publicly. There's an endodontist who has been out for quite some time. You don't want to be like this. Don't have me make fun of you on the internet for doing this. When we look at the different types of movements, they're classified by how much of it is being used. So class 1 is just moving your fingers, picking up an instrument. Right there is a class 1 motion. Class 2 is transferring the instrument. So now all of a sudden we're moving the wrist. You can see when I took all the pictures for this with my staff, we had a clean set. And so that's why I only have one glove on. I didn't think my other hand was going to be in there, but yeah, so that's why there's only one glove in the picture. Class 3 is where we now involve the elbow. We're moving out to reach for things. So reaching for a handpiece as an example. Class 4 is when we do the entire arm and shoulder. So that's moving up, like to grab the microscope. And then class 5 is when we are turning, as if we're turning to reach the cabinet. In general, you want to keep the classes as low a number as possible. Class 1, you can do all day long. Class 4 is going to cause a lot more wear and tear on your body over time. So you want to set up your operatory and your system so that you're not making those motions, which, yes, there is some bleach on the scrubs. If you look at this, I hope this guy's a left-handed operator, because if he was right-handed, notice that this over here is where he'd be reaching. So every time he has to go and reach for a handpiece, he's making that cross-body motion and using a lot more muscles than you needed to do. So obviously, if you're joining a practice, you may not be able to fix all of these things. If you do build a practice from scratch, please talk to me so we can make sure that we set you up so you can practice for as long as possible. In general, like I said, lower number is better. Okay. A lot of these pictures are from a free stock photo website, and it was very funny because how many of you hold a handpiece like this when drilling? You can tell this dude's just like an actor who was, or like somebody who's like, hey, I need to take these pictures as being a dentist. So that this is a handpiece motion. I love it. Anyway, static postures are much harder on your body than motion. So, for example, I want all of you now to just put your arms out like this in the air. Keep them out there until you can't do it anymore. We'll see who lasts the longest. Whoever drops their hands down first has to buy the first round of drinks in Salt Lake City at the AAE this year, okay? Cool. Now, this is when more than half of your muscles have to contract to hold the body against gravity. So you're probably not feeling it quite yet, but eventually those delts are going to start to be weighing in a little bit. You're like, oh, this is burning a little bit. Because you're in a static position, you don't get that fluid that helps kind of lubricate the area and bring the oxygen into there, which causes tension in the joint, and you can have hypomobility. And if we look at sitting in particular, because we do all our procedures sitting, if you are doing it unsupported, you're going to create a ton of pressure on those discs that's going to increase it by 40% compared to standing. I'm not saying to do root canal standing. We're not standing dentists anymore. But you make sure that when you're sitting, you are supported, because that's how you get hernias, which is not a problem, which is not a good thing. That's just sitting properly without having support. If you move forward or rotate, now all of a sudden it increases the pressure on those discs by 400%. That's a lot worse. Who's starting to feel some burning in their muscles, right? Okay, we're starting to get there. Yeah. Do you see how you're trying to move just a little bit? That movement there is it's bringing in extra muscles, and it's getting some fluid moving in those joints that are starting to burn a little bit here. Static postures, it doesn't seem like it's that hard. But as you start to hold it for a longer time, you're like, oh God, this is terrible. And that brings me to my next point. I have a trainer and a guy who does a lot of body work and some really cool stuff that I was talking to about this. And Eric was saying, think about if you did curls until your biceps were just burning, all right? Next day, you'd have some soreness in them, and then you'd start to see some hypertrophy. The muscles would grow a little bit. And they actually have shown that even that one intense workout you still get changes physiologically 30 days after that initial workout. You guys are doing a workout, whether you realize it or not, 8 hours a day. So don't you think that over time, we're going to start to see some changes? And those changes for us are have a very overdeveloped front part of our body, and we can very, very strongly grip things, but we don't have as much balance when it comes to opening. And so that brings my next point. How many of you can open a jar of pickles very readily, right? Yeah, exactly. Do you feel a little bit better after moving, Leighton? You got some mobility in there? And yeah. So the reason you all can open a jar of pickles, whereas you couldn't, and my staff has actually seen that. See, you start moving and you're like, oh, this is feeling better. You guys can put your arms down. I'm not going to make you do it the entire time. I'll buy the first round of drinks. You all did very well. That was longer than I thought you'd last. How many of you have burning in your shoulders right now? Okay, cool. I think the point was taken. I think you guys got the point that static positions, if you hold them and haven't trained for it, it can hurt. And so I even tell my staff, like, if you all work for me for a year, you're going to find all of a sudden you don't have to ask your spouse to open a jar of pickles anymore. You are strong enough to do it, no problem. And all of them have seen that increase. And it's because this is our daily workout. This is what we do all day long. So that brings us to the question, all right, we're going to have to, you all are going to have to do this. You're going to have to do dentistry. You have way too many student loans to not have to do dentistry. So how do you protect your body moving forward? And so we have a 3-step approach. First thing is the most important, which is prevention. Positioning yourself ergonomically so you can work comfortably without overworking muscles that are weaker or joints that can't really take the load, and that's important. Next is stretching. You are going to have to be holding some positions. So our hands are going to be forward. We're not going to work with our hands back behind us. There are things that we have to do the root canal. And so how do we take that information that these are the muscles that we're probably going to overwork and stretch to make sure we still have mobility in the ways that we need? And then the final one is strength training. And this is actually one that I started doing recently because I started having some issues, primarily with the antagonistic muscles. So if you've had pain in your forearm, most of the time, for almost all of you, your pain's going to be up top here. And that's because our lower, this right here, this is the dividing line. And this is after I have been, let me try to do this. Okay. This right here is kind of your dividing line between your closing fist muscles and your extensors. And if you look, mine are about 5-1. And a normal amount is about 2-1. And this is with me actually working over the past month to increase the size of these to help better offset it. So by doing strength training, what we're actually training is muscles that are antagonistic to the ones that we work out all day long. I have a buddy who works at a desk and he's trying to get fit. And so all he's doing is push-ups and crunches. And I like, Will, you can't do, like, you already are always forward. All you're going to do is that make yourself even more imbalanced and end up throwing out your back in the next few years. And so that's why it's important to work the muscles that we don't normally work out. We'll get into all that probably in the next lecture. So for the next probably 30 minutes, we're just going to be talking about how to sit properly. So it all starts with the operator stool. You guys brought one up, right? Or two up? Awesome, cool. Feel free to, as I'm talking, get up, take a look at it. If you haven't actually looked at all the things, you don't have to sit still. It's probably better actually for your joints to stand up and move around anyway. The 4 main things that you have, you're going to have the height adjustment. You're going to have the lumbar support, which covers your back. You're going to have the seat pan tilt, which is where it goes flat to kind of slightly curved. And then does yours have armrests? I think
Mine does.
Yours does. Okay, I was gonna say I thought one of them did. Oh, we have just a basic saddle chair. Oh, this is gonna be fun. We'll see how you guys like this one or not. Yes. Okay, that's what I was hoping we'd see one of those chairs. Cool, because I can show you. I actually have pictures of how to do that with one of Chris's chairs actually. So this is my chair. It is a GEDMed chair. If you do get this, they are quite lovely. They do come with a saddle seat. I never liked it, and so I went with the flat. But if you do buy these, go with the Tempur-Pedic. It's way more comfortable over time. It has the armrest. It's $1,800. They're an expensive chair, but I promise if you can work another year, you'll more than make up for the cost of it. It's worth investing in yourself. I have used one of these since I started practice. So I would take this chair with me because it's that important to sit properly. All right. For your height adjustment, what you want to be is at 105 degrees with your hips and knees. So slightly higher. Your hip should be slightly higher than your knees. It shouldn't be a right angle, and dear God, it should not be like this. What that does is it puts you into what's called anterior pelvic tilt. And that means your pelvis, if this is the front of your body, is rotated like this. That gets you that natural lumbar curve, which means that you don't put excessive force on things that don't want excessive force. When you have posterior pelvic tilt, which probably most of you do right now sitting because it's more comfortable to hunch forward when you're down in a chair, that creates extensive strain on a lot of things that you don't want it. How do you figure this out? This is the most easy way. It's the Instagram butt. When the girls stick their butt out, that motion right there is anterior pelvic tilt. And so when you're sitting in a chair, what you want to almost be feeling is like you're going to be taking a picture for Instagram. Everybody knows this look. That's why I did it. I wanted to stick inside your head. Thank you to the fitness dietitian, for showing the very clear example of anterior versus posterior pelvic tilt. All right, for your height adjustment, what is going to happen is if it's proper, it's going to reduce compression at these hip flexors right here and your psoas. And these are two very, very important, hip flexors and psoas. Now you can see it, right? The psoas, if you are reducing the compression on them, it's actually going to allow you to breathe properly, which is super important. And it's also going to reduce strain on your sciatic nerve, which if you've had sciatica, you don't want to have that. So if you are too short, and how many of you know the artist Too Short? Does anybody? Yes. Manu coming in. I love it. Sorry, Too Short's fantastic. If your psoas are too short, you're going to come into anterior pelvic tilt, which can lead to low back pain, which I have had once, and it's a terrible thing, which is one of the reasons I started doing all of this. And what will happen over time is that your glutes are going to be inhibited by this, so they weaken over time. One of the things my trainer is having me do right now is he calls it bridge and plank hell. That's all I'm doing all day long. Pretty much is just flopping around on the ground, trying to strengthen my back, pretty much everything along the back, because everything on the front has been so overworked from just doing dentistry. What will happen too is that the piriformis starts to go, you can get the sciatica, which is very painful. And then you also want to have your hips above the knees, which is what we call the hip angle. So if you want to go into a very deep dive on YouTube, you can watch how cyclists get their bikes fitted to them, because most of the time they want to have an open hip angle if they're doing longer distances. And so that gets you that neutral pelvis. It's going to reduce the flexion of your lumbar spine, which is exactly what we want. And we get more circulation down low, so you don't have that stagnant blood and fluid and all the other stuff there. If you're closed, you're going to start to have chronic hip pain, which is something I had, and I'm going to talk about that in a minute, why that was. And you can also get that low back pain. Thankfully, I have started to do the preventative stuff before I got it to chronic. But if you've had back pain ever, you don't ever want to have that happen again. So when we look at it, if you're too low, this is going to be, my chair thankfully is kind of higher just in general, because I got the tall one designed for me. Even this is still slightly too low. This is obviously too high. I look ridiculous here. We can all see that. And so at the 105 degrees, it's a much more natural looking position. So you can get out a protractor. You can do this with your phone, but ideally you want to think that your hips should be higher than your knees. I've seen plenty of people where they're working with their hips lower than their knees. And what they're doing is creating a ton of impingement right at the hips, which is not where you want it to be. Okay, next thing is your seat pan tilt and the lumbar support. And so the seat pan tilt is, I'll kind of go back and forth here. You can see how it moves. If you watch, I kept this straight. Notice how this moves down slightly. So we should see a slight downward tilt to the seat, and that gets you into that lordosis, where you have your stomach slightly sticking out, but you get that rotation of the lumbar spine. I think I've said that enough times. It's really important to get the lumbar spine in the right spot, because if you don't, you're going to end up with hernias and all the other bad stuff. And you don't want to slump back in your chair. This is a terrible AI illustration, but it really shows this is proper lumbar. Notice how these are nice and solid. Notice how when we start to go flatter, these discs start to collapse over time. That puts a lot of pressure on a bunch of nerves that you do not want to have chronic pressure on. If we are in a bad position, your erector spinae are going to have to overwork, which is going to cause a lot of that low back pain. Once again, those damn psoas, and oh my God, does it hurt to have these worked on? They're like down pushing and it's hurting all. You don't want to have these released. That's not a good sensation. You can also have issues with core stabilization. And so it's really important to make sure you're in that nice Instagram anterior pelvic tilt, because you get that really bad pain over time. And so this is one of the main reasons that dentists have to quit, is because of low back issues. And most of this comes from having the issues with the height and then the angle that they're sitting at. So lumbar support, this is, I always thought this was kind of silly, but after doing this research, I realized just how important it is. It needs to support the natural curve so you don't have to do it. That's why I'm going to be interested to see what you all think about that saddle chair that doesn't have any lumbar support. I think it's a really important thing. And what you want to do, this is too high. It should be down here if we're doing it properly. So it should be supporting it so you get that natural curve, and helps a bunch of different muscles and allows them to relax. So all of these, it goes down to your quads, your erector spinae, multifidus, all of those, if they're able to relax, it's going to make sure that they aren't overworked for a long time. And it's going to also, if you have to hold your body up, it actually recruits the fascia to do that, which can contribute to your low back pain. So all of it's not good. When we don't have lumbar support, and thank you again to my lovely stock website for having a bunch of people who don't know how to sit in chairs sitting in chairs, your lumbar spine is more likely to collapse into that flexion, which is exactly what we don't want to have. It's going to increase pressure on all your discs, hernias, all the fun stuff, and leads to chronic low back pain. So really important to have your lumbar support correctly done. And the key here is you want to bring the lumbar support to you, not you to it. All right. Okay. Next one. And this is where my hip issues came from. So how many of you, when you step on a scale, just do 1 foot? No, when you step on a scale, you have both feet with equal weight between them, right? This is how we should be working every single minute that we're not using the rheostat. And even then, you can still kind of keep it level. And what I realized I was doing, because I had chronic left hip pain, I had a habit of just rotating my foot out. I would curl it around the chair, or I'd have it kicked out. And that chronic motion all day long actually caused rotation of my pelvis, which then caused a ton of pain right down in my hip. Not good things. This is from work. And once again, it seems silly. I know that seems silly to compare us to athletes, but in a way, that's what we are doing. We are doing a workout all day long. And if you do it poorly, like I did, you'll end up starting to have a lot of chronic pain. So you want to have your feet be flat on the floor. Thank you again to my stock photo website. This is how I would often sit, with my left leg kicked out like this. So my right side, nice and stable, even weight here. The left side, though, starts to move out and causes those issues. This causes a lot of problems with hamstrings and glutes, which is exactly what I've been working with my trainer. It's going to tip your pelvis. And since I was asymmetrical, it's even worse. Always fun. It's going to mess up your pelvic floor muscles, which if any of you have had kids, you're the one who gave birth is going to definitely tell you how important those are. But you don't want to tuck your legs. You don't want to wrap it around chair wheels. We want to have even, nice distribution between the feet here. And this is exactly what happened with me, is I had sacroiliac joint dysfunction and pelvic rotation. Thankfully, we hadn't gotten to the lateral spine deviation yet. And so I'm working hard to strengthen the left side to get it to catch up to the right. So what we're going to show now is, this is Chris's chair. So he's an oral surgeon, so he stands all the time. And what I wanted to show is how you can still make this chair work for you. So this chair is too low, too short. You can see me slumping back here because the lumbar support is way too far back. And you'll see I'm at that 90-degree angle here. So excessive pressure on the hips, which is not where we want it. When I'm in the proper position, look at how the angle changes. So now we have that more 105 from here to here, and that lumbar support has moved forward to support me. I also think I just look like more professional here in this pic, like just to be like hypercritical. Like I look more professional like a doctor than here. I'm just like a little kid sitting in a chair. And so you want to be able to adjust your chair so it's at the proper position. For the armrest, I think these are really important because they help prevent shoulder and neck pain. How many of you have shoulder and neck pain? Yeah, exactly. And a lot of that reason is because your shoulders and neck are having to hold on to these things all day long, where you could be supporting that weight with armrests. And so when I work, this is what it looks like. I have my arms rested here. I'm able to easily have instruments passed to me back and forth. And you can see how close the chair, the ASI card is to me. So I don't have to do a big rotation. I don't have to stretch. I can very easily just reach over and grab like this. And you can see everything is nice and neutral and relaxed. We'll definitely get into this in a little bit here. So there we go. Armrests are there because they offer of your arm. So the average arm actually weighs about 30 pounds. And so actually, sorry, it's going to get to that in a little bit. There you go, 10 to 15 pounds. And so what you want to do is reduce that muscle contraction. Because right now, if I'm standing, if I'm in a bad position, you're overworking these muscles right here, which is why you all have that muscle pain. And so you want to offload that weight onto the armrests. So imagine you're walking around with a 30-pound weight and you're holding it every day off to the side using your spine. That would hurt over time, right? It's like going back and doing this again. That's what you all are doing right now, not using armrests. Now, I know you're in residency, you can't do it, but when you get out, strongly consider a chair with armrests and make sure you use them. And notice my staff also are using them. Miriam's arms are on the armrest right here as well, because it's important that she also sits in a neutral position. It takes a long time to train your staff members properly. You don't want to lose them to musculoskeletal issues as well. And we'll definitely talk about the microscope and how important I think the side scope is. Okay. How many of you have pain in these two spots right here? I guarantee it's every single one of you, right? Your trapezius is the big triangular shaped, I guess technically it's diamond if you do both sides. And it is going to have to elevate and stabilize your scapula if it's not supported. And then the other big one is going to be your levator scapula. So all of this, if you are moving in a direction, if you're having to hold yourself, it's all those muscles surrounding the scapula that have to overwork. And so how much of this sounds familiar? You have tension, headaches, upper back tightness, knots, neck pain. And it's because you're overworking those muscles. So there are some ways to kind of stabilize it, which we'll get into, but having armrests is key. The other big one is going to be your rhomboids and your serratus. So your rhomboid is this little dude right here. Serratus kind of comes down. It's always called the boxing muscle because when you push a little farther, that motion right there, that is your serratus. All of this is to stabilize the scapula. Once again, the scapula is super important to make sure that it's nice and stable. And if you are having to hold it up all day long, it's going to overwork those muscles. Your deltoids, you all know about that. That leads to your rotator cuff strain, which is exactly what that guy in the picture was doing from chicken winging out. You don't want to have your arms up like this. Have them nice and down to your side. And that's exactly what we're seeing here. So by not having the armrest and having your arms up like this, you're statically loading just like this all day long. That's going to overwork a bunch of muscles that you already have pain on, and it's not going to get better with age. The trapezius, this guy for sure is going to need rotator cuff surgery eventually. You can have issues with all the cervical spine extenders right along here. How many of you have that tension right up here in the back of your neck? That's from that. And if you look, that's exactly what's happening here. These muscles on him are getting seriously overworked because he's working like this and holding it all day long, and he should be using the armrest and supporting himself. So let's practice sitting. So the first thing we want to think about is when we are sitting, is your weight on your tailbone, so you're rotated into that posterior pelvic tilt, or is it on your sit bone? So the sit bones are actually part of your femurs. That's where you want to be. It's kind of like that iliac crest on the bottom. You don't want to be on your tailbone itself. And so that the way you get into that is by getting that Instagram booty and pushing your kind of almost stomach forward. I like how all of you are sitting up a lot straighter now. I'll sometimes give lectures to like hygienists on oral facial pain. We'll talk about massage techniques, and you'll see all of them like just start rubbing their masseters and just like, oh, like it's one of the fun things about lecturing. Next thing, go ahead. Oh, well, I can hear myself now. What the heck just happened? I don't like that. Okay, I'm gonna mute. You see that? Okay. When you have to, I'm muting you because I'm hearing an echo and it's driving me crazy. So when you guys have to talk, you'll just have to unmute yourself, Leighton. I think you're in charge of the computer. So, okay. Next is spinal awareness. And so we want to have your lumbar spine curving inward. So if those of you have done yoga, you know the cat-cow position. You don't want to be rounded over like this. You want it to be up and having that nice natural rotation to the lumbar spine. When you first do this, you're going to have soreness in areas that you don't normally have soreness in. And after about a week or two, you'll actually notice a difference. Even between taking those two pictures, the first stock images, the pictures I took of me sitting in my chair to the pictures of me sitting in Chris's chair, I can see a difference in how I'm sitting because I've become way more cognizant of it by putting this presentation together, which is why I like lecturing, and you all should lecture too because it makes you better. And you will have like kind of weird muscles working out that you didn't know that you had. And after a few days, everything will be much more stable and it'll be a lot better for you, I promise. So that's the next thing. Lumbar spine should be curving inward, kind of like you're doing the cat-cow. Okay, shoulders should be nice and relaxed. We don't want them elevated up like this. We don't want you to be doing root canals like you're like, hey, what's the point? Like you want to have nice, slow, or like nice low shoulders that aren't, being worked on by all the muscles that you guys all have pain on. And then we want to have the head nice and neutral. And so this forward head posture, you can see that is causing a ton of work. Your head is also very heavy. The muscles in our neck are not very strong. And so if you're chronically going like this, you're going to be overworking a lot of the muscles pulling your head forward, and they're very small muscles. Ideally, you should have a nice neutral in line with your spine head posture. And this is a lot to do with the microscope, which we'll talk about as well. Okay, moving on to your lower body. Are your feet flat with equal weight on them, or do you have one curved around the chair and kicked off to the side? Even pressure is super important. So I want you guys to think of being on a scale when you work on patients this afternoon. The knees should be slightly below the hips, and pretty much that's what we want to look at. You can see the difference in how much more neutral I look compared to that. You actually even see by having the bad posture, my head is even a little farther forward than it is after. So really important. I know it seems small, but this is a really important thing to do. And so when you're going through the process, you want to adjust the height first. So if one of you wants to hop in the chair so you can practice this right now, go for it. I don't care who it is. Turn that down a little bit. Sorry, it's getting hot in here. All right, Leighton, see if you can try to unmute now and see if it's echoing still. It may have just been on one thing. No, I'm still hearing myself. Okay, so we'll get onto the saddle chair. And we should see. Does someone else want to get into the other chair? Just so you can both. Cool. Excellent. This is fun. All right. The first thing we need to adjust, and the only thing that you're going to be adjusting is the height adjustment. And so it should be feet are both flat on the floor. And then you adjust the height up so your thighs are angled slightly forward with your hips above the knees. You should feel nice even pressure on both feet, and you shouldn't feel any strain in your hips. How is that? Is that different than you guys have said previously? Yeah. Does it feel weird or better?
Better. A little weird.
Good. Yeah. And that's definitely what we want to have. Now, when you're doing that, you want to feel like your pelvis is sticking forward slightly, like you're on Instagram. Carmen, this will be a lot easier for you in the saddle chair. That's why these are designed, actually, is because it kind of forces you into that anterior tilt. This part is going to feel weird. I have to keep catching myself doing it when I sit. You want to have that rotation. It feels weird. And especially when you're like hyper focused on a calcified tooth or getting a thermophil or whatever out, it's very normal to kind of collapse down and kind of go back into that negative lumbar curve. And so we want to have that natural rotation instead. So does that feel odd for you guys to do that?
I definitely feel some tension on my lower back.
Some tension on the lower back? Yeah, and that could be because you don't have the lumbar support necessarily, but it also could be that you're not used to working that area. Because when I started doing it, I definitely felt like a weird pressure, almost like a stretch in the lower back. But that's what you want to have. You want to have that nice curve to the lumbar support. I don't know if the saddle chair can do the rotation. Does it tilt at all? Do you know?
No, it doesn't.
It's pretty set, yeah. And the reason the saddle chairs are nice is it forces you into that anterior just by how it's shaped and how it comes down like this. It uses your legs and your natural anatomy to push you into that position. Leighton, is yours able to do the forward tilt?
Yeah, the lumbar support can't, but the chair can. Like the seat can.
Oh, okay. So your lumbar doesn't go forward. That's annoying. Okay. There is a way to address that. But yeah, if the seat's you definitely want it slightly tilted forward. It shouldn't feel like you're like falling out of the chair, but it also should feel that it's very easy for you to just sit up from the chair, like stand up from the chair and not have to like, use your body. It should feel like almost like a natural squat position. Okay. When this moves, anterior like this, you're going to feel that the weight's no longer on your sacrum. It's moved forward onto your sit bones, which is where you want to have the weight to be done. Okay. Lumbar support, unfortunately, it seems like this one doesn't do it, but you want it so that it comes to you, not you to it. The way you could make this one work is by having just like a little piece of foam that you put between there. But it is, if you start to notice low back pain, it would be really important to do this. And make sure it's in the proper spot. We've all taken anatomy. You know where the lumbar spine is. You don't want it. I've seen it. Many people have it up top, like they're supporting, like it's sitting in the chairs like you all are right now, not down in the actual lumbar position. And then armrests. You want to get everything first. A quick go through it just so you guys know how to do it. But you want to have your arms hang by your side. Just see where you are naturally. Note that position, and then put your arms on the armrest. If you go up, you're too high. And if you find yourself like kind of having to slump down, it's pretty easy. But a lot of people have their armrest up too high. And even with it being supported, it's going to overwork this area. Elbows should be close to the body, not to the side. And because you guys don't have armrests, that's going to be the best way for you to do it, which I'll go into in just a second. But you want your forearms to be pretty much nice and parallel to the floor. You're going to look like a T-Rex. Little short arms, this is all you can use. You don't want to have this part engaged when you're working. So if you don't have armrests, you are now the armrest. So elbows in, you don't want to be overworking, but you should have some tension kind of along your chest near the pec. And then to help prevent overwork, every 30 minutes, which I know you guys are definitely taking longer than 30 minutes for root canals, it's a good idea to just release. Stretch out a little bit, kind of loosen things, roll your shoulders back. Yeah, get some motion in there so that that synovial fluid can get to where it needs to be, because you don't want to be holding that position for too long. Okay, another benefit is something called a physiologic tremor. How many of you have heard this term before? Okay, what I want you to do is put your hand out like this and look at your fingers and keep them as still as possible. Do you see how there's still a little bit of motion? Have your hands spread out like this. Do you see how there's still just some slight, tiny motion? That's how our body, we have always just a little bit of firing going on in the neurons. A lot of this came from the ophthalmology literature, because when they're doing surgery, all of a sudden those tremors become a lot larger when you're having to suture an eye closed, when you're having to do, neurovascular closures, things like that. Now all of a sudden that motion becomes an issue. And that's where something like the Da Vinci surgery robot is being used for a lot of these really fine things, because humans have this natural thing. Now, hold your hand up close to you like this and look at your fingers. Notice how they don't seem to move as much, because the rest of your body, maybe you guys haven't had as much caffeine as I can. I can see a difference for sure. It's not like this and I have to use my whole thing. Still, my hands are looking almost like this. There's slight motions. It's not that bad, but you get the idea. When you have support, now all of a sudden the muscles that are engaged are much smaller. And so by having an armrest, you're taking your farthest away point to where you need to do motion and you move your hands from all the way up here down to your elbow, or ideally almost up to your wrist, depending how far forward your armrest goes. So that's a major benefit of it. And we'll talk about that a little bit more when I talk about the microscope. Okay. Here's your main takeaway. Imagine doing a plank or this for 8 hours a day. You guys did that for like 2 minutes. And you started to have some tension and other issues. You want to let the chair do the work for you. The other thing, your chair's just another piece of equipment. And if you use it wrong, you're going to, and you all are what's going on. Okay. Yes, we did just spend an hour on how to but it makes a huge difference. What questions do you all have for me at this week?
What chair did you say you got, and would you recommend we get that?
So this is the company. And you can see kind of how they have different ones. Mine, see, they do a stool here. This is the one that I have. And as soon as you put 2 armrests on there, it's really expensive, really fast. But it is a wonderful, wonderful chair. It'll help you practice for a lot longer. I don't know if they do residency prices, but maybe.
I find that I kind of, when I'm working, I don't know if it's because I'm shorter, but I have the armrest still, but I have to have forwards more than I want them to be in order to reach and still be on the.
Yeah. What are the questions you guys have?
I've always tipped my chair forwards like that because it's the only way I can get my feet on the ground. And Greg used my chair one time and was like, he came up here and was like, why is your chair tilted like that? That's so weird.
Like the anterior tilt?
Yeah.
Yeah. This one's nice because this adjustment here is pretty minor. It's only like 5 degrees. I have seen ones where they're excessive, like 45 degrees, and you're like falling out of the chair. So that could be one reason. It could also be you're not used to sitting in the proper way. Because none of us, how many of you taught this in dental school? Nobody. Like maybe a small little thing on like don't do dentistry like this, but the actual ergonomics is not. What are the questions you guys have?
So you said it's like normal to, like, I feel like even right now when I'm trying to sit in the chair, it does feel like pretty uncomfortable. I feel like it gets like pretty tense. You say that's normal for a couple of days? Do you do a warm up every day or stretches every day?
I do. Okay, I'm going to mute you guys because that goes pretty bad. Okay, on to microscopes. You've heard me say this before. Microscopes are like Barbies and AR-15s. It's all about the accessories. Once you buy the first thing, it's all about where you get everything else from. And you don't necessarily need to get those accessories from the same company that makes the microscope in the first place. And so there's lots of fun little things you can add to your microscopes here. So having the right accessories is really important, and they have a bunch of different accessories to help make you more ergonomic. You don't want to look like this. This, once again, is the stock photo, and this is actually a pretty good one. It has the ergo extender plus a little extender right here, but notice how she's really far forward with her head. Once again, this is just the stock photo website, and thank you, Pexels, for letting me make fun of your people, of your models. The benefit of the microscope is it allows you to maintain everything we just worked on for the past 45 minutes, plus get your head and neck level. So you're nice and neutral. Once again, that neck fusion surgery is not a pleasant thing. My dad's had it done. He's not a dentist, but he had it done. That's a pretty rough one. You don't want to have that done. They actually go in from the front, wildly enough. They move everything out to the side and go from the front to do the surgery. Anyway, the components of the microscope. Your actual microscope, if you look at it, the actual microscope part is just this part right here. This right here is what contains all of the lenses. And really, this actually I should have taken this out too, because that's also an extender. That's an accessory that can be on there. But you have different step levels of magnification. Ideally, you want to have 6 steps, with the lowest being like you're using loops, so you can use the microscope for anesthesia. This is the one thing I don't have, because I was able to get both of my microscopes used with all the toys for less than the cost of one new one. So it was okay for me that I have to do anesthesia outside of the scope to save lots and lots and lots of money and get really solid microscopes. But ideally, you want to have one where you can do anesthesia through it. The next part is your binoculars. This is what you actually look through. This is what most people think of as the microscope themselves. And it's important that they're inclinable because you want to adjust the binoculars to you, not you to it. And so when microscopes first came out, they looked like this. This is one of the early versions of the Zeiss microscope. Notice this goes straight up and down. So you would have to look at it like this, which causes all of that issues with the neck. Mine, you can incline, you can move them up and down so that you can adjust it so it's nice and natural for you. It really is important to have these. I don't think they sell scopes without them anymore. All of you have binoculars you can move up and down, right? Yeah, I think so. Yeah, it's definitely important to have. If you ever are curious about what zoom level you're at, you'll notice on the side of them, it has this 10x. All you have to do is multiply the number on the binoculars by the number on the microscope, and you'll figure out what the zoom is. So if mine is at 0.4 and this says 10x, you multiply the two of those together, that's 4 times zoom. So mine goes from 4, 6, 10, 16, and 24. Those are the steps that I have on my microscope. Ideally, you want it to be a 10x binoculars instead of 12.5, which is what they come with naturally. I find that I don't really need to use that 24 times zoom very often. And I'd rather have it be a little farther back so I can do the exam and the consultation under the microscope rather than if it's too far zoomed in, you can't really do an exam or see things. Like mine is, it's very annoying. Mine's just out of the side. So I have to do like 3 and 14. I do have to move the patient back and forth because it's just outside the view of it. Next thing is the ergonomic wedge. This is also called the car extender for the global ones. It's a 45-degree kind of wedge that moves the binoculars closer to your eyes. And this is a really nice thing because it allows it so you are a little farther back from the microscope, and it can have a built-in splitter. So this is mine. These are all pictures of mine. I took it all apart. It was terrifying taking apart a multiple tens of thousands of dollars microscope and not dropping any of the glass components. But this is a splitter that you can have for even more accessories. The big one here is the fine focus. You guys all have this on your scopes. It allows you to move up and down once you get everything set. And this, I would not buy a microscope without one of these as well. What it allows you to do is as you get deeper to the tooth, and we'll talk about how to set up the microscope, you start by having it all the way up at the top of the tooth. And then as you access, you can just rotate this little dial, which moves it farther down. And you don't have to move the microscope up and down during the procedure. You can just gently move this instead of having to move the microscope, which is really important. You have to have this for photography. And there are different lengths that they come in for the focal lengths. So at 4.6, I know you're taller than that, would need to be around maybe a 200 millimeters. For most people, you'll find that the 250 millimeters works great. I'm a little bit taller, and so I need more separation. And so I like mine at 300. When I've used 250s, I kind of find that I have to either push the patient up too high, which moves my hands up, or I have to be shrunk down. It's an awkward situation. They do have a new, I did see the global one actually goes from like 200 to 350. So there are some that can give you a really wide range of view, but you want to make sure when you're getting your microscope set up that you talk with them and get the proper one for your height. This is not a very expensive component. That first thing, that's what you're actually paying for, is the microscope body itself. The binoculars are anywhere from about $5,000 to $10,000. This is like a $400 or $500 piece, depending on the company you get it from. And so it's not that if you buy a scope, you can accessorize it just like you would with a Barbie and get this piece to fit to it for a lot cheaper than buying a new microscope. These are huge ergonomic extenders. It's just air in there. There's nothing. There's no glass. They're cheap. You can get them. These are actually the Zeiss ones because I have the one that came with the scope, but you can get them for a lot cheaper because it's just a piece of metal. It will darken your final output slightly, but it makes a huge difference to make sure that the microscope's in the proper position for you. You can have a camera adapter on top of there. I just made a full video on YouTube on how to add a camera to it. I'm happy to help any of you if you're looking into doing it. This is the one that I have here. There are specific focal lengths. Once again, if you are adding a camera, talk to me and I'll help you set all that up. There's multiple adapters available for every style of microscope. Mirrorless is my preferred one. What I did say in the video is I don't necessarily love having the camera, like Zeiss's proprietary camera, because if it goes, you have to buy a whole new one. If this goes, I can take the camera that I'm recording on right now, pop it off and pop it on there, and I will be able to take pictures right away. So it's much easier to replace it because electronics do go bad over time. I've always said photography makes you a better endodontist because if you're taking pictures of it, you want to make it look as pretty as possible. So video makes you an even better endodontist if you're curious, because then everything is there. But take pictures. That's one thing I would say in residency. Learn how to take good pictures now while you can. The other thing is it also protects you from liability. If someone comes back and says you didn't find MB2, you can take a picture and show, here's your 2 MBs. It's a really, really useful tool. Then finally, the assistant side scope, you'll notice I have an extender on this for them as well. I wouldn't work without of it. Many people do. It helps with making sure they're ergonomic. It helps making sure their suction and their water in the right position. I never have to tell my staff, move your suction, I can't see. You guys haven't had to work with an assistant yet, but that's something you'll say quite often. And this allows them to see exactly what I see. It also gets them more engaged in the procedure. When done properly, it should be that you have a neutral neck that's not turned side to side. You actually want it to be that the muscles. Okay, spinal line, you guys get it. If we have problems and the binoculars are too high, you're going to end up with extension of the neck, which causes all the pain in these 2 spots right here, which you've definitely felt, the suboccipitalis, upper traps. If it's too low, you're going to be in flexion, which is going to cause issues with your sternocleidomastoid and the scapula once again. If it's too far away, you're going to have issues with your ector spinae, all the bad stuff. And so you really want it to be that you don't have to repeat adjust. It should be nice and neutral. And so if you look, both of us are lined up in line with the microscopes. I think at this point it is 11. So I am going to stop this real fast.